Hi guys, this is Dr. Dalton from Hammond Chiropractic, and I wanted to make a special video for you today because I've been noticing a lot of people coming into my office with carpal tunnel syndrome, which is something that chiropractors work with quite a bit, believe it or not, and we have great success with it. And so I wanted to do a little bit of research on the topic in order to prepare this video for you today, and I think you're going to be a little bit shocked, or at least I was shocked with what I was reading online. I like to go to a website called PubMed. It's pubmed.gov. And what it is it's where our government actually keeps information on every single research that was ever done in healthcare in general. And it's not just medical in medicine, it's also within chiropractic, osteopathy, anywhere where research has been done as it relates to healthcare, you can find it there and you just search for different things. So I was reading this one article that I had come across and I wanted to talk to you guys about. But before I get into the article, I want to first talk about what the carpal tunnel actually is and what carpal tunnel syndrome is so that you have an understanding about what the article is saying to us. Now, the carpal tunnel is actually in the hand, all right? It actually happens in the wrist, more specifically. And what we find about the carpal tunnel is that the bones that make up the wrist, we actually call those the carpal bones. And you can kind of feel them right here in the hand. And on this side of the hand, we call this the palmar side of the hand, or the anterior side, there is a ligament that comes across. It starts from this side of the carpal bones, goes over and attaches to this side of the carpal bones, and then all of the tendons and the nerves and the blood vessels pass through this tunnel or canal that's created between the bones and that ligament that goes on top there. And so we call that opening the carpal tunnel. Now, what can happen here, and this is what carpal tunnel syndrome actually is, there's a nerve that passes through that tunnel called the median nerve. And the median nerve, it actually starts in your neck, believe it or not, travels through the shoulders, down into the arm, and then it passes through and it controls my hand. Now, if something happens where there's a lot of pressure inside of that carpal tunnel, it can put pressure on that nerve, and now you start to develop a lot of weakness in the hand, pain in the hand, tingling or numbness, and that sort of thing. And so what is typically done with this, or at least from the medical perspective, is that they do a carpal tunnel surgery, which is where they go in and they actually cut that ligament on top, which opens up the space and in theory takes the pressure off of the nerve. Well, that sounds fantastic in theory, right? But actually the success rate of this surgery is not that fantastic. And so let's talk about this research here first. I was kind of blown away. I mean, we see this all the time. I see a lot of patients who have had the surgery and it doesn't help, and so they end up coming to us looking for another solution. So, we see this occasionally, but I didn't realize what the real statistics were on the topic. And what I had found was I had come across this article, or this research study. It's called Revision Surgery for Persistent and Recurrent Carpal Tunnel Syndrome and for Failed Carpal Tunnel Release. And this was published in Plastic and Reconstructive Surgery, which is a medical journal. And that was done in March 2012. And here's what they had to say. They were looking at the success rate of two different types of carpal tunnel surgery that are performed. And what they said was that they were looking at 50 specific patients, and out of the 50 patients, 34 of them had no improvement at all. Now that is a failure rate of 68%, which means that only 32% of these surgeries are successful. And then in addition to that, what they said is that over time, the problem almost always comes back 100% of the time. And we have known this clinically. I see this in my practice all the time, that even people who have the carpal tunnel surgery, and if they even get relief from it at all, typically it's going to return, and there's a few reasons for that. Now, what they were talking about is that they were saying that there's a few reasons why this success rate is so low for this type of surgery. The first reason being doctor error, meaning that the doctor either did the surgery wrong, didn't cut the right thing, okay, or they accidentally cut or damaged that median nerve when they were going in there to do the surgery. So that's something that can happen as well. The other thing that they found is that the big issue is that the problem was misdiagnosed, that the problem actually wasn't carpal tunnel at all. And that's what we're going to talk about in just a minute too. The next reason that they said that this surgery is unsuccessful in this regard and that the symptoms typically return is because after you do the surgery, in 100% of the cases, they found that there was scar tissue that had developed around the median nerve. So because they had gone in there and done the surgery, it caused the scar tissue to develop, and that causes more pressure on the nerve, which makes the problem more serious at that point. And then finally, when they talked about misdiagnosis, what they said was that it's possible that these carpal bones that we talked about just a minute ago, that they can actually subluxate. And they used that chiropractic word, which I was excited about. You see, everybody thinks of chiropractors as strictly working with the spine, and that is our main focus. And of course, the reason that we focus on the spine is because it houses your spinal cord, and the nerves that go out to your body and communicate with the body and also provide power for the body to function properly, they exit your spine. So if there's any misalignment in your spine, it cuts off that power supply or that nerve flow, and it causes problems within the body. So we want to avoid that. However, anywhere where there is a bone and a joint, a chiropractor can work on that. We work on shoulders, elbows, wrists, knees, hips, ankles, feet. I work on pretty much everything in my practice, all right? If you've got a problem somewhere, we can probably take a look at it. So what they were saying is that it is possible that this ligament here isn't the problem at all, that really a problem is that these bones can actually misalign or subluxate, and that puts pressure on the nerve as well, and that needs to be corrected. Now let's talk about why this misdiagnosis happens so often. A lot of times people experience pain or symptoms in the hands or in the arms, and they think that they have a hand or an arm problem. And doctors think the same way. You know, this is the one disadvantage of doctors specializing, is that we see the same things over and over again, so of course we expect it to be that problem. So a doctor who works on hands is expecting to see carpal tunnel syndrome a lot of times. But what gets misdiagnosed a lot of times is that the problem doesn't always start in the hand. It's actually very common that we see a problem in the neck area, putting pressure on the nerves where that median nerve actually begins, and you actually feel it out where the nerve ends. So you can have the problem in the hand, but the source or the cause of the problem is actually in your neck. And if you never have the neck looked at and evaluated, if there's a problem there and it isn't corrected, you're going to continue to have issues here. But what we take even more seriously than pain is function. If you start to get weakness in the hands where you can't, and I have patients, believe me, that where this happens, where they can't lift a cup to drink their coffee, or they can't write because they can't hold a pen or a pencil, it can get that serious where you start to lose function. That's the thing that we want to avoid, because once you get to that stage where you start to lose function, it's very difficult for us to ever get that 100% back to normal again, all right? So what's the moral of the story here? The moral of the story is, before you consider hand surgery if you are experiencing carpal tunnel syndrome symptoms, I think it's a great idea for you to get it checked by your chiropractor first. Have somebody look at your neck just to make sure that something isn't going on there, because if the problem is actually coming from your neck, you can cut on this all you want to, and you're never going to get the relief that you're looking for. However, if the problem is here and we correct this up here, you're going to feel better down here. And that's the whole moral of the story here. So make sure you go to your chiropractor, have them evaluate your neck, and have them also take a look at your wrist and your arm, just to make sure that you're treating the actual problem that's causing the symptoms, because if you misdiagnose this and you do it wrong, you're not going to be happy with the end result. Now, the other thing that I want to say about this is that if you truly do have issues with the hands and with the wrist, which, by the way, it happens. I'm not saying that 100% of the time the problem is the neck. I'm just saying that when it gets misdiagnosed, that's usually what we find. However, there are a lot of people who use their hands a lot. Let's say people who are on a computer all day, or me as a chiropractor. That's actually one of the things that cause disability within my profession most commonly is carpal tunnel syndrome, because we're using our hands all day to make adjustments to people. There are some stretches you can do that will actually help to alleviate some of these symptoms as well. And they're really, really easy to do. I'm actually going to do them for you right now. But really, one of the quickest and easiest things you can do is just do this. You want to straighten up the elbow on the arm where you're stretching, and you're going to just pull the hand back, all right? You want to make sure that this here stays straight through the whole stretch. The reason that this is helpful for someone who has wrist or hand problems is because all of the muscles and everything that control my hands, they actually start in my elbow, and then they travel down and they pass through that carpal tunnel like we talked about, and that's what allows us to move our hands. So by stretching the forearm, you're actually going to experience some relief in the wrist and in the hand. So we're going to stretch it out here. We're going to hold that for about 30 seconds or so, and where you're going to feel it is all along the front of the forearm here underneath your wrist. So we'll do that for 30 seconds. Then what we want to do is we want to go in the other direction, doing it once again for 30 seconds. And this time you're actually going to feel it on top of the forearm going up into the elbow here. And there's one other little thing. Some people will notice that they feel pain in their thumb when they start to develop these problems. And it's a real simple thing that we can work on as well. All you want to do, you want to take the thumb and you want to circle your fingers around it so that you hold the thumb in place here. And then you're going to straighten the arm out again. and you want to bring the hand down, and you can actually help it along if you want to also. You're going to feel it stretch all the way along the thumb and going up into your forearm as well. Same thing, you want to hold the stretch for 30 seconds. So in addition to seeing your chiropractor to make sure that you're correcting the actual problem that's causing the symptoms, you can get some temporary relief by doing those stretches on your own. The other thing, of course, that will help with some of this is using ice on it. Anytime that something is inflamed or irritated or angry, if you put ice on it, it will help to calm it down. Now, there's some rules you have to follow, though. With ice, we only leave it on for 15 minutes at a time, and you take it off for at least an hour before you repeat that ice treatment again. And you put it on the source, or wherever you're feeling the pain is where you want to use the ice. So that's something that you can also do at home on your own to kind of help alleviate some of these symptoms. But like I said, if you're feeling that, before you get the surgery or before you're even considering that, make sure you see your chiropractor so that you get the issue corrected conservatively without surgery if you possibly can. And then if the chiropractor can't help you, or if the stretches or whatnot don't help you, at least now you know that you've tried other things first, and then you proceed with the surgery or do whatever it is that you need to do. All right, that's all I have to say about this topic today. I really appreciate you for listening to me. I hope you found that helpful, and we will talk to you next time.